Welcome to Nash Fit Training Podcast. I'm Dr. Nash Jocic, PhD in philosophy, author, international speaker, fitness expert and nutritionist, and former bodybuilding champion. In this podcast, I will provide you with proven and effective strategies that will help you lose fat, build muscle, and completely change your body composition. The insights and advice I will share are grounded in scientific research and theoretical knowledge, but more importantly, they are drawn from my own experience as well as the experiences of my clients over the past 4 decades. So, let us dive into today's topic. Hello everyone. In this episode, I want to talk about the reasons why do we get fat and how does it happen. There are 2 sides of this problem. The first one is psychological side and the second one is physiological side. I will first emphasize the psychological side of the problem, as psychological tends to emphasize behavior, emotions, and their interactions with the eating patterns. I will then focus on the physiological side of the fat accumulation process itself and explain how the problem of fat accumulation can be addressed successfully. I will also use expression of the fat accumulation instead of the expression weight gain. As for you who have listened to the previous episode, I have explained why fat loss is much more important than weight loss. I will start with psychological reasons first for getting fat. There are many, but I will mention only a few which I consider the most important. Number 1 psychological reason is emotional eating. Using food as a way to cope with emotions such as stress, anxiety, depression, or boredom can lead to overeating and fat gain. Interesting enough, it is very rare to hear that a person is eating less because of emotional problems, although it does happen. More often, people just accumulate a lot of body fat because they start to eat more and usually eat processed foods full of sugar and fat, hence high-calorie food. When food becomes the only comfort during these stress situations, fat accumulation occurs. The second reason is stress. Chronic stress can increase levels of the hormone cortisol, which can lead to cravings for high-fat, high-sugary food and result in fat accumulation, especially around the abdomen. Although necessary hormone in the cases of intense exercise, when present in the body for a long period of time during stress situations, cortisol can cause a lot of health problems. Number 3 psychological reason is depression. Depression can lead to overeating or a preference for unhealthy comfort foods, contributing to weight gain. Certain antidepressant medications can also have side effects that lead to fat accumulation. Number 4 is body image issues. Poor body image and low self-esteem can lead to disordered eating patterns, such as binge eating, which can contribute to fat accumulation. Number 5 is habitual behaviors. Unhealthy eating habits developed over time, such as snacking late at night or eating large portions, can be difficult to break and contribute to gradual fat gain. Number 6 is lack of awareness. Being unaware of calorie intake or the nutritional value of food can lead to overeating and poor food choices, resulting in fat accumulation. People generally have very little knowledge about healthy foods, necessary number of calories for maintenance or preferable body composition, amount and ratio of macronutrients, and also timings of meals. Number 7, we have social and cultural factors. Social pressure and cultural norms can influence eating behaviors, leading to overeating in social settings or adopting unhealthy eating habits common in certain cultures. This is a very common reason for fat accumulation. For example, people in socially or financially deprived sections of the society tend to eat more unhealthy processed food high in calories. Also, people often justify their way of eating simply because it is their traditional way of eating, regardless of unwanted consequences. Now I would like to talk about food addiction. Some individuals may develop an addiction to certain types of food, particularly those high in sugar, fat and salt, leading to overeating and fat gain. I want to pay special attention to sugar, as it is a main culprit in fat accumulation. Sugar is known to be very addictive, as its addiction is linked to the same reward center in the brain that is responsible for addiction of substances like nicotine, heroin, or cocaine. This area is known as the brain's reward pathway, and these are the reasons for sugar addiction. Number one is dopamine release. Consuming sugar stimulates the release of dopamine, a neurotransmitter associated with pleasure and reward. Similar to addictive drugs, sugar consumption activates the mesolimbic dopamine system, creating feelings of pleasure and reinforcing the behavior. The second one is reward pathway activation. The nucleus accumbens, a crucial part of the reward pathway, is activated by both sugar and addictive substances. This activation leads to reinforcements of behaviors that result in dopamine release, whether it's consuming sugar or using drugs like nicotine, heroin, and cocaine. Number three, it's behavioral similarities. Just as with drug addiction, the repeated consumption of sugar can lead to cravings and compulsive behavior. Over time, the brain may require increasing amounts of sugar to achieve the same level of pleasure, similar to the tolerance seen in drug addictions. Now we have withdrawal and cravings. Reducing or eliminating sugar intake can result in withdrawal symptoms, including irritability, mood swings, cravings, mirroring withdrawal from addictive drugs. Sleep deprivation is also known to disrupt hormones that regulate hunger and appetite, leading to increased cravings for unhealthy food and weight gain. Psychological conditions such binge eating disorder or other eating disorders can lead to excessive calorie intake and fat gain. The similarities in the brain's response to sugar and addictive substances highlight why sugar can be so difficult to reduce or eliminate from the diet. Understanding this connection can help in developing strategies to manage and overcoming sugar addiction. Addressing these mental and psychological factors through therapy, stress management techniques, and developing healthier coping mechanisms can help us in managing fat gain effectively. Although the responsibility for the problem of accumulation of fat is not only on individuals but also on the society and its political establishment, I believe that personal responsibility is still the paramount of healthy living. Individuals are responsible for their well-being and their options are not restricted unless ignorance prevails. Educating oneself about the fundamentals of healthy eating and effective exercise is now easier than ever before thanks to the amount of information which is available for free on internet. I will now explain the physiological side of the problem by explaining what is actually happening inside the body that causes the storage of extra fat tissue around the internal organs and under the skin. Fat that we store around our organs is called visceral fat, while the fat that we store under the skin is called subcutaneous fat. And while subcutaneous fat is more visible and causes our concern, visceral fat is the fat that damages our health much more. Because visceral fat accumulates around our vital organs in the trunk area, it contributes to the expanded area in that region known in everyday's language as the big belly. High visceral fat is linked to increased risk of heart disease, high blood pressure, and diabetes. Since visceral fat is more metabolically active, it tends to accumulate faster than subcutaneous fat. Visceral fat tends to accumulate more quickly due to the factors like high stress levels, leading to increased hormone cortisol, consumption of high fat and high sugar diets, and lack of physical activity. Subcutaneous fat tends to accumulate more gradually and is influenced by overall caloric intake, physical inactivity, and genetic predispositions. But the good news is that the visceral fat seems to be first to go when we are on a fat loss diet and effective training program. Due to its high metabolic activity, visceral fat will be used first before subcutaneous fat. Fat accumulation is the result of a complex interplay between diet, lifestyle, genetics, hormones, and other physiological factors. Understanding these factors can help us developing strategies to manage or prevent excessive fat accumulation, which is crucial for maintaining overall health and reducing the risk of chronic diseases. These are the primary physiological factors for fat accumulation. Number one is energy balance. Overeating or caloric surplus is extremely crucial for understanding process of fat accumulation. The most direct cause for fat accumulation is overeating. When you consume more calories than your body needs for its daily activities and metabolism, the excess energy is stored as fat. The right choice of food can solve the problem of overeating. Now we have metabolism. We all have different metabolic rates. Some people have slower metabolisms than others, and the slower metabolism can lead to more fat being stored. But there are ways of speeding or increasing one's metabolism. The second factor is hormonal influence. I will start with insulin. Insulin is a hormone that helps regulate blood sugar level. When you eat, particularly carbohydrates, insulin levels rise to help glucose enter cells. Excessive insulin production, often due to high sugar and refined carbohydrate intake, can promote fat storage, particularly in the abdominal area. The second important hormone, as I mentioned before, is cortisol. Known as the stress hormone, cortisol can increase fat accumulation, especially visceral fat, when chronically elevated. This is often seen in individuals under prolonged stress. Leptin and ghrelin. Leptin is a hormone produced by fat cells and signals the brain to reduce appetite and increase energy expenditure. Ghrelin, on the other hand, stimulates hunger. Dysregulation of these hormones can lead to overeating and fat accumulation. Number 3 factor is genetic predisposition. Some people are genetically predisposed to store more fat due to inherited traits. This includes factors like body shape, metabolic rate, and fat distribution patterns. Adipocyte number and size. Individuals are born with certain number of fat cells or adipocytes, and while this can expand or shrink, the number can increase, especially during childhood and adolescence. This can predispose someone to easier fat accumulation. Number 4 are dietary factors. Diets high in sugar and refined carbs cause rapid spikes in blood glucose and insulin, promoting fat storage, especially when these foods are consumed frequently. High fat intake, particularly unhealthy fats like trans fats and saturated fats, can lead to fat accumulation. However, not all fats are equal, and healthy fats like those from avocados, nuts, eggs do not necessarily contribute to fat gain in the same way. Number 5 factor is physical activity. A lack of physical activity reduces the number of calories burned, contributing to our energy surplus. Over time, this leads to fat accumulation. Having more muscle mass increases your resting metabolic rate, helping to burn more calories even at rest. Less muscle mass can contribute to fat accumulation due to a lower metabolic rate. Understanding these primary factors for fat accumulation will help us build strategy for fat loss. Correct dietary and exercise plans applied on a regular basis will successfully help one burn extra body fat and achieve good healthy shape. It is important to emphasize that discipline and consistency in applying effective dietary and exercise programs are essential in achieving wanted results. Fat loss is a lengthy process and may last several months. Also, after achieving desired shape and body fat level, one has to be careful not to revert to old lifestyle of overeating and inactivity, as he or she will regain lost body fat. Once you have achieved the desired results, you should not change your new lifestyle, and you should continue to exercise and eat correctly. Now, I will talk about a successful strategy that will help one burn extra body fat. Let me first focus on energy imbalance, which is influenced by overeating and specific metabolism. Overeating usually happens when an individual eats a lot of calorie-dense foods. The right choice of foods can solve the problem of overeating. Instead of processed foods, which are full of carbohydrates, sugar and fat, much better choice is to eat meat, fish, eggs and vegetables. These healthy foods are full of protein, water and fibers, which are difficult to overeat and they easily cause satiety. When it comes to metabolism, the problem of slow metabolism can be solved by eating high-protein foods in every meal and also starting a correct exercise program. Protein increases one's metabolism as it is required much more calories to digest protein than fat and carbohydrates. Effective exercise does not burn calories only during exercise, but more importantly speeds up metabolism during the rest of the day, and also up to 24 hours a day. So high-intensity exercise is clearly the fundamental factor that will speed up your metabolism. Now let us say a few words about hormonal influence. When it comes to insulin, hyperinsulinemia or high levels of insulin is not only the easiest way to store body fat, but is also the major risk factor for most chronic diseases. Reducing the amount of carbohydrates and exercise will make the body more insulin sensitive, which will lower the amount of insulin. Cortisol overproduction can be tackled by reducing stress and avoiding overtraining. Training for long hours is unnecessary and causes higher cortisol levels. So people who spend long hours in the gym doing weight training and cardio training, they should think twice, because overtraining can easily lead to high cortisol levels. Leptin and ghrelin. Healthy levels of leptin and ghrelin can be achieved through healthy diet and regular exercise. Eating high-protein foods and also healthy fats together with regular and effective exercise will regulate hormonal level. Sleep is also very important when it comes to healthy hormonal levels, and for that reason, sleeping between 7 and 9 hours per night is necessary. When it comes down to genetic predispositions, we know that there are people who are genetically predisposed to store more fat due to inherited traits, and they have to be very disciplined and consistent in practicing the already mentioned healthy eating and effective exercise. They have to be more consistent and more disciplined than others, but the most important thing is that this genetic predisposition to store more body fat can be easily overcome. When it comes to dietary factors, the biggest problem is sugar and refined carbohydrates. So eliminating all the foods that are high in sugar and refined carbohydrates will help to maintain healthy level of glucose in the blood, which will lead to fat loss. Also, the problem of high fat intake should be tackled by reducing the overall amount of fat in the diet, and especially trans fats, meaning hydrogenated fats, and also seed oil. Reducing the amount of fat intake will directly reduce the number of calories in a daily diet. Physical activity is critically important, and implementation of effective exercise will contribute to higher energy output and also will speed up metabolism, causing the body to burn even more calories during rest hours and sleep. If you have higher level of muscle mass that you can achieve through effective high-intensity exercise, you will increase your resting metabolic rate, and that will help you burn more calories even at rest. Less muscle mass can contribute to fat accumulation due to a lower metabolic rate. So let me recap now. In this episode, we have learned why do people get fat due to the psychological factors, and also how is the fat accumulation process happening in the body. We have also learned how these problems can be eliminated by changing one's lifestyle, meaning eating healthy, exercise regularly, and avoiding stress. As from the previous explanations, you have realized that I often mention healthy diet and effective high-intensity exercise as the necessary tools to successfully burn unwanted body fat and stay lean permanently. I will spend more time in the coming episodes focusing more in detail about healthy eating and also effective exercise. But for all of you who are interested in these topics and want to learn more now, you can find detailed explanations in my ebooks such as The Ultimate Nutrition, Feed the Muscles, Not the Fat, Fat Loss and Weight Training, and also Build Muscle, Burn Fat, which are all available on my website nashfittraining.com. And before we sign off, I would like to thank you for your support and thank you for tuning in. I hope that you have enjoyed this episode, and if you did, please leave us a review on Apple Podcasts and Spotify. Please share this episode with others who may be interested in this topic. Also, feel free to let us know what topics you would like to see covered in the future episodes. And if you love this episode, don't forget to subscribe to the podcast and never miss an episode. Take care of yourself and see you next week for a new episode.